one thing that they dropped completely when they came out with the final rules. And when you consider how much stimulus money and how much meaningful use money there is to fuel that initiative, it just made no sense for them to drop that. And quite frankly, that's going to be one of our biggest initiatives when we move forward with the ACO, because that's how we're going to collect data, that's how we're going to ensure continuity. And one of the things that Pam was talking about is that the Healthy Doctor, Healthy Hub product, where it's not only inpatient records that populate, you actually go into the physician's medical record and populate that medical record with information from the hospital. And that's pretty critical when you think about it. Sitting in your physician's office, and the physician has immediate access to information from an outpatient procedure, from an inpatient procedure, all types of different information that's available that traditionally has been something that they haven't had access to. And that's been one of the biggest obstacles with regard to continuity between the inpatient and the outpatient environment, is the lack of that information flowing from the hospital to the physician's practice. So that's going to be a big push for us, because that's how we're going to control costs, that's how we're going to ensure quality, and that's how we're actually going to track data to make sure that we're meeting the quality indicators that we have to submit to CMS.
Alex, did you want to say something? Sure. Okay. I saw you up. Okay. Anything else, Casey?
No, thank you very much. Thank you.
Anything else, Pam? This was put on for informational only to the board. It's a report, which I'm very happy that you gave. I didn't put it under the consent calendar because I felt that it deserved an update to this board. I know that at the annual doctors meeting that this was given, some of it, and I felt that the board should hear it too. Correct, Doctor? Mm-hmm. So I thank you. And we'll move on. 16F, physician recruitment for general surgery, subspecialty, colorectal surgeon. And it looks like it's you, Donald, again. Thank you.
Unanimously approved by Finance Operations and Planning Committee. Recommend that the Board of Directors, that it will be in the best interest of the public health of the community served by the district to obtain the services of a general surgeon with a subspecialty colorectal surgery to practice in the community served by the district, and to approve a colorectal surgery recruitment agreement for an amount not to exceed $1,230,000 in a term of 1 to 3 years. Surgeon will be presented to the Board of Directors prior to final execution of the agreement.
Second. It's been moved and seconded by Director Coulter. Now we'll have discussion. Donald.
This is again one of our initiatives to move forward with engaging physicians where we have a need in the community. Just want to bring to the board's attention or just remembrance that it was actually in January of 2011 when we had our report back on our physician needs assessments, which was conducted for prior years. And part of that assessment resulting in us identifying that in terms of physician need, there's a category which is defined as substantial. The substantial need in that report reflects that there is either a need for greater than or at least 10 physicians. In the general surgery category, this was exactly what was identified, that there was a need based on a population ratio of surgeons to the population size within our district, that there is a need to add that degree of a complement to our services. Subsequent to that, what we have currently in our environment is our colorectal surgeon, who's actually removed himself from the emergency call list. So he's no longer available for emergency call, and he's actually reducing his time in his office as he's pursuing other business opportunities. So it's incumbent on us as a district to make sure that we have the subspecialties to support us, and hence we're coming forward to this recruit. There's one thing I need to bring to your attention. It is that we generally do not come to the board with this type of an approach as it relates to our physician recruitment. Generally, we have the candidate who's here, we've done all the performance, etc. But in this particular subspecialty, I think it's critical that we be able to establish some guidelines to go out and recruit. And here's the reason why. Currently in practice in the United States, there's 1,574 colorectal surgeons. As far as fellowship trained, that will be coming out of fellowship this year. There's actually 71. That leaves about 1.2 colorectal surgeon per state available to recruit. So within this subspecialty, it becomes very challenging. In fact, some of the candidates that we're looking to consider are as far away as back east in New Jersey. So it's nice to be able to provide them with something to say, we are committed, we're moving forward. We want you to consider us as well as all the other opportunities that may be coming your way, and we're going to pursue it in that manner. We are clearly open to recruit someone in the local area if that candidate meets the qualification that's set forth by the medical staff and is established through the agreement. But clearly, we want to have the opportunity to go a broader swath if need be, simply because this particular specialty is so challenging to fill.
Director Schauer.
Just wanted to make a couple of comments. I support this process. The board needs to be aware that what you just said, this is different from how we have traditionally handled recruitment contracts. So, and when we talked about this in finance, this will probably be not the only one that may come this way, but other specialists will use and adopt this same process. When you find a physician that you want to bring here, they still go through the medical staff review process to become a member of our staff. And the physician will, per what this says, will be presented to the board of directors. However, we're not voting at that point. Once we vote for this, then you have the authority to go and recruit, and you're just bringing the person here. So that's different from what you said. That's different from what we've been doing, but perhaps more efficient in how we do it.
So it gives us the latitude to be able to reach out in a much broader pattern. Yes.
The reason that we're asking for some additional latitude here, just to put this issue in perspective, there's about 5,500 hospitals in the United States. There's 1,500 surgeons who practice in this subspecialty. So there's only one for every 3 hospitals. And you have to assume that some hospitals, the Mayo Clinic, Cedars, probably have more than one. So there's a significant nationwide shortage in this subspecialty, which is why we think we need a little flexibility in talking to someone, being able to confirm a commitment before we even bring it before you.
Director Horton.
How many physicians in this subspecialty are not on our staff that are practicing in the community served by our district? Do you know?
One physician right now at this point in time, and as I mentioned earlier, he has actually removed himself from the emergency call, so he is still practicing within the district.
But are there other physicians that are not on our staff that are practicing in the community served by our district?
No.
For other hospitals?
No.
There's only one guy?
Yeah, one guy.
Thank you.
Director Anderson, did you have something?
No.
Any other questions?
Yes.
Director Sterling?
With the fact that we are supposed to be taking care of our immediate population, and we're going to be suggesting up to a little over $1 million for 3 years, as I see this, I'm concerned about the potential for overutilization of the health. And when we keep putting it in here, it says for the benefit of the interests of the public health of the communities that we serve. And yet we have primary care physicians that are the gatekeepers that are supposed to refer these patients for these specialties. We've neglected our primary care. You're asking for $1 million and over $1.5 million, well, $1.2 million. At the same time, you want a blank check to go out and recruit someone that a population of 500,000 people, you can't tell me how many are going to need colorectal surgery to pay off the return of our investment. I also recall Casey Fatch saying that he was going to send a document to me for me to review, and to this day I have not received any of the public records requests that I have made orally at the board meeting in compliance with public records and open meeting law.
Point of order.
And
Talk to the subject.
Mr. Coulter, you used the point of order improperly simply to cut off the discussion and deliberation, and that is improper. Now, I had a question, and I'm entitled to know those answers for the representation of my constituents, period. I'm not out of order. You're out of order for interrupting me and using parliamentary law improperly just to cut off discussion.
We've had 2 calls for point of order.
I asked a question. We're not in law, Mr. Coulter, with a phony PhD. I'm asking a question, I'd like it to be addressed. What is the return on our investment for $1.2 million? Can you tell me, without overutilization of our consumers of 500,000 in this district?
The response, legal counsel is giving one response, but I would just share with you. I think the return on the investment is to be able to provide the service that the community needs.
And how do you determine that need? How do you determine that need? That need was supposed to be sent to me for evaluation.
How do you vote?
No.
Director Horton, how do you vote?
Yes.
And Director Anderson?
Yes.
And Director Coulter?
Yes.
Director Kelly?
Yes.
Director Shallett?
Yes.
And Director Reno is a yes. 6 yeses and 1 no.
Point of information, Director Reno, I asked you as the chair of the board that the needs assessment be sent to me as promised.
Then will be Bank of the West equipment financing.
And there is a proposed motion.
See the
Do we need
clicker?
the-
Are you paying attention?
I am.
He takes the clicker and he lifts it and raises it lower. Now he's writing and he's got it on camera and you've got it.
Very qualified municipal.
And there he is with his smug little smirk.
Authorizing the.
The bald-headed crypto-Nazi.
Municipal equipment.
As he just lifted it up, right there,
Bank of the
see?
West, an amount not to exceed $2 million with an approximate interest rate of 3% for a 5-year term, and to authorize the CEO to negotiate the best available terms and conditions associated therewith. To approve and authorize the CEO to execute the February 2, 2012 term sheet, and to authorize the CEO and other authorized officers to execute any and all agreements and instruments as by legal counsel on behalf of the district to provide for such equipment lease financing, provided the negotiated terms and conditions are consistent with or more favorable than the February 2, 2012 term sheet.
Second. Anderson? It's been moved and seconded. Discussion.
All right. Good evening again. I want to make a little presentation about the municipal equipment financing with Bank of the West. What I'm requesting is approval of a municipal equipment financing through Bank of the West at a rate of 3%. Now, the reason why we're going to be able to get this equipment financing at such a low rate is that we're going to be going to external counsel for a tax opinion of letter that qualifies us as a municipal entity in order to get these low rates. And what we're requesting is financing up to $2 million in capital equipment, of which the Mazer and Brainwave pieces of equipment are part of that $2 million. Excuse me. The fees associated with this financing is $500 per lease schedule, and any and all other costs that is incurred in order to close the transaction. And all the legal reviews will be conducted by Procopio prior to the execution of any agreements. So I'm open to any questions, comments, or concerns you may have.
Director Shallett.
Mr. Mosher, I have a couple of questions. One, we have the term sheet, but I don't have a resolution. And the second one is the motions, when this came through finance, we didn't have a resolution number. This says 748, but I went back to last month when we were doing the resolutions on Bank of the West and on Compass, and it was 747 and 748 were the two resolutions that we used at that point. So should this really be 749 and 1 and 2? Do we actually have to have the physical resolution in order to vote as long as we have the term sheet? I don't know, does anybody else have a resolution?
No.
I feel bad because I didn't catch that part.
Yeah, and I have not seen the resolution. Obviously, what this motion includes is pretty much everything that would be in a resolution.
Right.
But you don't have a resolution before you, so you shouldn't approve it as a resolution. The motion, like I say, the motion itself could be a resolution. I'm not sure what slip happened. I think it was planned to be on last month, didn't get on last month, and I think it's just a paperwork error. I know the term sheet
Sloppy.
exists. We've seen the term sheet, and that has all the essential terms in it.
Right.
The resolution had the legal authority for has the legal authority for making this kind of making this kind of deal. So I don't have any question about the legality of it, but I think you're right that you can't approve it as a resolution per se.
So,
Remember when you
well, right. Just tell us what.
Yeah, you can just call it a motion
Okay.
for this purpose.
Can I amend the motion I made to abolish?
If you get a second, yeah.
To abolish the board resolution number 748 and make it just an motion.
Okay.
It's been moved by Dr. Calla to amend, and it's been seconded by Director Anderson, Charlene Anderson, to amend. Now, do we need to repeat the amendment?
We vote on the amendment.
Yes, we vote on the amendment. Should we repeat the amendment?
The amendment, as I understand it, is simply to remove references to the resolution.
Remove the reference to the resolution. Okay, Director Sterling, how do you vote?
On the amendment, yes, remove the amendment of resolution number 748 entitled "A Resolution of the Board of Directors of Tri-City Healthcare District authorizing entering into a bank," and then you go on to the qualified municipal equipment lease agreement, unquote. Is that the entire quote that's being removed?
It would read, "I move to approve authorizing the district to enter into," and then the following motion.
Well, Director Horton, how do you vote?
Yes.
Director Anderson?
Yes.
Coulter?
Yes?
And Director Kellett?
Yes.
And Director Schallett?
Yes.
And Director Reno is a yes. Motion.
And I,
Then you need to vote the
excuse
main
me,
motion.
I will vote yes on that clarification that legal counsel made by the quotes being removed. And now I have a question about the main motion.
And what is your question?
I got 3 minutes, so please don't interrupt me. I'd like to know, in the fact that we had discussed last month that there would be a collateral, all the collateral that Tri-City owns, the, accounts receivables or accounts payables, our equipment, our furniture, everything, if this is going to end up becoming part of that collateral.
No, this is simply a form of financing where the equipment will serve as the collateral for the financing.
And so both, the equipment is the two items that you mentioned earlier. Was it just two items, the Mazer and the?
No.
What is it all we're looking
Those two items
at?
are a part of the list of capital equipment, up to $2 million. And we're starting off with the two pieces of equipment, the Mazer and the Brainwave.
Director Horton?
How much is Mazer and how much is Brainwave?
I believe the Mazer was approximately $750,000, and I believe the Brainwave was, about $250,000.
Thank you.
Any other questions? Okay, I'll call for, somebody call for the motion. Director Sterling, how do you vote on the motion?
We haven't seen the contract, and I understand, is this just to give us latitude? It's going to come back as a contract, or what?
No,
No.
we've abolished the contract.
All right, then no.
We're approving the term sheet. Right.
Voted no.
No.
Director Horton, how do you vote?
Yes.
Director Anderson,
Yes.
and Director Coulter,
Yes.
Director Kellett,
Yes.
Director Shalek,
Yes.
and Director Reno is a yes. What was your vote, Director Sterling?
I said no because we haven't seen the contracts.
We need one. 6 yeses and 1 no. Motion carried, and we'll move on. Thank you, Alex. Now we're going on to item H.
I move to approve the resolution authorizing the formation of limited liability company with PET Imaging of North County LLC, an affiliate of North County Radiology, that will provide facilities and space, equipment, non-professional personnel, and certain administrative services to North County Radiology, quote, NCR, unquote, at the NCR practice sites as mutually agreed upon by the LLC and the NCR, and 1, acquiring a 50% membership in the LLC and purchasing of membership units in exchange for an initial capital contribution of $2,500, and 2, authorizing and approving the execution and delivery of an operating agreement.
Second.
It's been moved by Director Shalek and seconded by Director Kellett for the resolution of the PET. Any discussion? Director Horton?
Well, my book doesn't have anything in it about it. You guys have sheets in your book?
I don't have anything either.
Something that we don't get to see anything about other than the resolution? Are you seriously asking us to do that? Don't you think that's a little facetious?
I think it's all here. I think it's all here.
There's nothing here. There's nothing in the
This was
book.
discussed.
It's just a resolution.
This was discussed.
I know it was discussed, but how are we supposed to vote on it because we weren't in
I'm
closed
not going to
session?
answer that because I'm telling you,
I
this was all that was discussed. in
I
closed
understand
session.
that, but how is anybody supposed to cast an intelligent vote when they haven't been part of the briefing? That's
What was
absurd.
told to you in finance and ops?
No, the problem is that you throw this stuff in front of us, and no prudent elected official would vote yes for something when he doesn't even know what it is he's voting for.
Well, I'll defer this one to council, from council.
I have seen actual resolution on this, but it says exactly what the motion
That's what I tried to
here
tell them.
says. And this motion would be sufficient if you just move to approve a resolution and then the motion as follows.
And should not, if he, as long as Mr. Dawkins provides some sort of a discussion for all the board members as to what the resolution relates to, then he's going to be providing the information.
Absolutely, the staff can
So
certainly
he needs to
provide
go
the briefing
ahead.
as
Yeah,
to
we just shouldn't vote.
what
He
this
needs
is
to
about.
provide some information as to what the resolution.
Yes, because all we were given was what you see.
Right, but we did hear a presentation, so,
Okay.
Where did you hear the
So
presentation?
about,
in closed session.
in closed session of finance and ops.
And let me ask you then, who is supposed to be on the LLC representing the district's interests?
Okay,
We're going to have a discussion by Donald Dawkins on this. Maybe it'll come out.
It'll come
Go ahead,
out.
Donald.
Thank you, Chairperson Reno, members of the board. What we're bringing before you in the closed session item that was discussed earlier is the proposal to participate in a joint venture imaging environment where we would work with PET Imaging LLC of North County and form a limited liability imaging LLC to provide facilities and space, equipment, non-professional personnel, and administrative services. The district would participate as a 50-50 member with an initial capital contribution of approximately $2,500 to establish the LLC so that it can begin its work. Why are we considering this and why are we bringing this proposal to you? As you know, it's critical that we look at how we partner with not just our physicians in the community to provide services in the hospital environment, but also how we provide services in the outpatient environment. One of the things that we've seen historically, especially as it relates to imaging services in an outpatient venue, is a out-migration of our services, meaning our competition is basically stealing our population and providing these full-service imaging environments right here in our community and pulling our patients away from our particular facility. So what we've also identified is that we really have a very difficult time competing with a standalone, privately held imaging environment. And the reason for that is because their overhead and their cost structure is significantly lower than we can provide here in the hospital. They're able to gain contracts that we are not able to either retain because the payers are saying, I will go to the provider who is the least expensive that can provide the same quality of service. And so that's one of the things that we're seeing. So we need to reach out by creating an environment where we can recapture our business, promote our physician alignment, and establish competitive threats to these encroachments on our business model. When we looked at our overall volume of services in terms of imaging modalities, we saw our volumes go from 17 to 13,000 over the last few years. We've seen our net income reduced, we've seen our contribution margin reduced, and as I mentioned, we've seen our patients leaving our district. So we're proposing a model here, which is a joint 50-50 venture to, one, create a full-service comprehensive imaging environment that would allow for both our patients to receive this continued service going forward. Additionally, for the question that was asked earlier, what would be the membership? Again, it's at 50-50. There would be Class A and Class B members. Much like other LLCs that we've presented to you, there would be 3 representatives from the district and 3 representatives from PET LLC on the board of managers.
There's another issue that's addressed by this proposal, and that is that our outpatient imaging equipment is now aged, and we need to replace it anyway. So we need to either do that on our own or do it in partnership with our radiology partner, and we would prefer to do it in partnership. We think that makes sense. That will hold the cost down for both parties and allow us to provide state-of-the-art outpatient imaging equipment on a more economical level than we're able to do it on our own.
Questions? Director Horton?
So are the locations known or unknown, or what?
At this point in time, one of the locations that we would consider is currently there's a location on Waring Road which we would look to expand into some available space there. But I think the beauty exactly of creating this type of an environment is that if there are other opportunities that are within our district that we want to establish imaging services, for example, in the medical office building. We put a lot of physicians there. We would like to do something jointly in that particular building to do so. A convenience for patient, an efficient environment to provide those services. And so we've not limited the potential location, but we definitely have considered a local location up on Waring Road.
Another point of clarification is that a significant purchase of imaging equipment would come back to the board anyway, even though you'd be authorizing, all you're doing here is authorizing the creation of the LLC. Additional purchases that are beyond my purchase authority on our authorization matrix will come back to the board for your review and approval.
The equipment is bought exclusively by the hospital then? That's our part of the partnership?
No. What would end up happening is that the equipment would be purchased, again, based on the ownership structure here, which would be 50-50. So what I've also mentioned, which is something that the board needs to be aware of, is that whenever a hospital goes out to purchase equipment, especially capital equipment, you find that the hospitals are often charged much, much higher for that equipment than you would in an outpatient environment or a physician-based environment. And so we believe that this will also provide some attractive considerations for us relative to capital purchase.
And when and if ever do we see documents that are involved?
The operating agreements can be made available to you anytime.
Do they already exist?
We're finishing that up just as we speak today. So that will be available to any board for to review.
Do you expect, or in the boardroom?
Absolutely.
Okay.
If the drafts are in existence, how come they weren't included in the board packet?
Because one of the things we don't want to provide is a draft document. We want to give you a final document. I do have them here if you want them to be distributed at this time. I just figured it's a matter of convenience and the order of business is take quite a bit of time to try to get through those, but those were only received today.
And there's another part to this. The Finance and Operations Committee did not meet until last Friday. And this was brought to them first.
Right, the schedule has changed, and so we were actually pushed
And
to
we were
try
under
to
the
get all this
gun. We were under
information.
the gun for minutes and also the resolution.
Director
But let's
Reno?
be fair.
I do also want
Let's be fair.
to bring to the board's attention that as part of the process of moving forward when we establish these kinds of joint venture LLCs, is that we will have to go out and do evaluation, not only of our services by a third party, but of the services that we would be partnering with to see what is the true cost of the contributions from each party so that there's an equitable balance. Additionally, if there are equipments, like Larry mentioned, or other major considerations that need to take place within this joint venture, that information will have to come forward to the board for the board to make a decision. So really what we're asking here for is the opportunity to embark upon structuring this environment. And that's really about it. We're not going to start doing anything until the board is authorized.
And
Director
the final
Reno?
thing that I'll say is that we're being approached by physicians who are affiliated with this hospital to engage in a number of joint ventures with them. And I think that's a huge plus because that didn't happen when I arrived. That's happened primarily because of the outstanding success we've had working with the surgeons in the North Coast Surgery Center. The other doctors are seeing that, and now they're saying, hey, hospital's not a bad business partner for us to have, and we'd like to find ways to partner with you. This is just the first of a number of these ventures that are going to be coming forward to the board in the next few months.
The document's there, I'd like to see it.
So would I.
Document, distribute it.
When will it be completed?
It's complete now, he says it's ready to distribute it.
And I'd like to see it too.
No, he said it's the final document. Distribute it.
I'm sorry.
Distribute the document,
They
it's the
want
final
to distribute it
document.
now to see, but I think they need to be numbered and returned.
No. It's already left a closed session. It's now a public document.
Oh, for the question.
No, it was developed.
Number
It was
one.
not developed until today.
It hasn't been adopted yet.
Anybody wants to run this meeting with blabber now?
Well, you've got point of orders always interrupting the deliberation of the board, so, either we deliberate and discuss it, or you can just have point of order always interfering.
All in favor of the motion signify by, no, I can't do that. How do you vote, Director Sterling?
No, I will have a question. I
How
would
do you
like,
vote, Director Horton?
no.
How do you vote, Director Anderson?
Yes.
And Director Coulter?
Yeah,
And Director Kellett?
yes.
And Director Schalik?
Yes.
And Director Reno is a yes. 5 yeses, 2 nos. Motion carried. We're going to move on, please. And you may come to the board office and read it.
Why should I come to the board office and read it when it's right here, right now? Isn't that the silliest thing you've ever heard?
Yes.
It's not completed.
It is
He
not
said-
done, and we told you
He said it was
that. It's a
completed.
draft, it's a
He
draft
said it was
form.
completed.
It is not, he's
No, he
incorrect.
said it was completed.
Well, it's
It's
a
a
draft.
draft.
It isn't what he
Why don't
said.
you believe the
That
CEO?
isn't what he said. He said it was ready
Where
to
are you,
distribute.
Donald Dawkins? I want you to come back here and make that statement that it's a draft. Thank you.
It is a draft. Our legal counsel has to have a chance to read it. The district counsel has to finalize it, make sure everything is there. As I said, we received it today. He needs to have a chance to go through the document completely, and that's really all.
Thank you. Thank you very much, and we'll move on. Okay, we're going on to Chief of Staff, consideration of the February 2012 credentialing actions involving the medical staff.
I move approval of the February 2012 new appointment credentialing actions involving the medical staff as recommended by the Medical Executive Committee at their hearing on February 20, 2012.
Second.
Okay?
Chairperson, could I speak for a minute?
Yes, sir.
Okay,
Of
just-
course you can.
Thank you.
Okay.
Thank you. I'd like to just take this opportunity to again thank the district, the foundation, the administration for honoring the medical staff on its 50th anniversary with the beautiful sculpture and the installation, the eternal fountain in the atrium. Again, medical staff is very grateful and honored for that gift. Second, I'd like to on behalf of the medical staff, congratulate Larry Anderson, who received the Businessman of the Year Award from the Carlsbad Chamber of Commerce, honoring his work with leading the Tri-State Medical Center as he has. Again, congratulations. And then finally, I think what we've seen today with the robotics system, the different institutes, it shows how much can be achieved when you develop a good working relationship between the medical staff, the administration, and the board. I think this is just the beginning of a bright future for this hospital. I think if we continue to work together, we can achieve a lot. And I think this is just the beginning. Thank you.
Thank you for those nice words. Okay. I'm going to call for the vote. How do you vote? Do we have to vote on this medic? Director Sterling, how do you vote on the credentialing actions?
Yes.
And Director Horton?
Yes.
Directors Anderson?
Yes.
Coulter?
Yes.
Kellett?
Yes.
Kellett, 3 are yeses, 7 yeses. Motion carried. Now we'll have consideration of the consent calendar.
Approval of the consent calendar. Second.
Need a second?
Okay.
Coulter seconded? Okay, and then I need items to be pulled. I myself would like to pull, only for introductions here, item, I think it's A4. 4A, I beg your pardon, 4A, Human Resources. I would like to introduce 2 people under 4A, Human Resources. Thank you, Doctor. We'll move on, hearing none.
I have a question on consent calendar.
Yes, ma'am.
You made a motion on the consent calendar. I have a question regarding it. In reviewing the consent calendar, it indicates here that the California nursing law will be held, it's a meeting in Carlsbad. Is this for board members to attend?
Yes.
And who would be attending?
We don't know yet.
Yourself
To
and...
discuss the item, you need to pull it.
No, I'm discussing the
discuss the item,
consent,
you need to
I'm
vote.
discussing the consent
We need
calendar.
to pull it for discussion.